This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Now, he's a 54-year-old gentleman who has got this white, mature cataract. And the biometry shows a very shallow antechamber. It's somewhere less than 2 millimeter. And this is the time to examine these lenses and get an idea whether is this case at high risk of inducing Argentinian Flag Sign. The patient is 54, relatively young. The capsule would be slightly elastic. That's a risk factor. Number 2, the chamber is very shallow. Again, a risk factor. He has an intumescent cataract. That is also a risk factor. Now, what sort of intumescent cataract would it be? Now, when we look at the slit lamp examination pictures, we can clearly see there's an area of fluid, and then there are areas of swollen cortical fibers, lens fibers themselves. So whenever we have the fluid, it is actually a good sign for the surgeon, simply because this tells us that there's a lesser risk of an Argentinian Flag Sign. Now, what does the lens OCT show? Let's look at the lens OCT again. This is the scan of this lens. What we can see is a giant pool of fluid is present just below the capsule, and then we have got the swollen lens fibers as well. So presence of this fluid is a good sign, in the sense the moment we touch the capsule, it passively egresses out and the lens bag decompresses spontaneously. Whenever there is a pressure drop in the capsular bag itself, the risk of the rexis running away dramatically decreases. This is my assumption. Now, I'm having this assumption in spite of knowing that the antechamber depth on biometry is showing a very shallow antechamber depth. Okay, so my strategy for all intumescent cataracts of late has been to give them a block, either a posterior subcutaneous block or a peribulbar. But the important thing is to have a good massage. The massage helps us to make the eyeball soft. Now, in this case, whenever we have an antechamber depth less than 2 millimeter, I also have an additional IV mannitol given to the patient. Now, this is the secret to avoid an Argentinian Flag Sign, that is having a soft eye. Whatever it does to have a soft eye when you enter and touch the capsule. When there is an absence of any posterior positive pressure, the risk of the rexis running away is minimized dramatically. So the incisions are made. It's mandatory that I have to have a good staining of the capsule under the air bubble. This is how I prefer. Once the staining is done, OVD is placed into the eye. I'm using a dispersive OVD, which is a combination of chondroitin sulfate with sodium hyaluronate. And then the main incision is created. Time to perform the rexis. So just keep a close observation as soon as I touch the capsule to puncture it. The capsule is punctured with my regular Dr. Haldipurkar forceps. The moment I touch the capsule, one can see the fluid just egressing out. Now, this is a good sign. At this stage, the risk of rexis extension will be very minimal because there is a spontaneous decompression which has happened. You don't have to go in and to aspirate the fluid. It has just come out spontaneously. The intercapsular pressure is down. The capsule would behave well. The capsule is folded and then the tearing is begun, and I can feel that the tearing is very well controlled. In a situation where I feel that I'm losing control, then I would like to shift from the shearing technique to the tearing technique. And I'm aiming for a slightly smaller rexis, maybe 4.5 to 5 millimeter. That's what I'm aiming, and I got it. So the most difficult step of the surgery was the rexis itself. When the rexis is done, managing the nucleus is not a big issue at all. So planning ahead and having the right strategies would definitely help. I usually avoid any hydro dissection in these cases. So what are the settings for chopping? Since the patient is relatively younger and the nucleus is soft, I am using a power of just 10% longitudinal in a burst mode for holding the nucleus, and the vacuum is set at 600 and the flow rate is 30. The tip is buried into the substance of the nucleus, then the vertical chop is performed, and then the nucleus is rotated until the entire nucleus is broken into 6 fragments. So now is the time to perform quadrant removal. The settings have changed, and these are the settings for quadrant removal. The vacuum is 700, flow rate is 60, and the bot light is kept at 90 centimeters. Power is continuous torsional, and it is at 30%. So nucleus management is probably the easiest part in this case. The last fragment is aspirated. Little bit of an epinucleus in soft lens matter is there, which is absorbed, which is aspirated. Time to deal with the cortex, which is very little. Now this rhexis is slightly smaller. Would I want to enlarge it? Well, no, it looks like about 4.5 to 5ish, so I just want to keep it the same. The cortex is aspirated out. The bag is inflated with OVD. The planned single piece IOL is now being implanted into the eye. OVD both in front and behind the lens is aspirated out. The side ports are hydrated. That's it, the case is done. So to summarize, when you look at an intumescent cataract, it's always better to look at the variant of intumescent cataract. If you have well-defined areas of fluids in between the lens fibers, then it's a definitive indication that the Argentinian Flag Sign or rhexis extension is less likely to happen, and this is a good sign. In cases where we don't find these lens pockets of fluid, and when it is the lens fibers themselves are swollen, those are the situations where there is a higher risk of the rhexis extension happening. And in those cases, it's also difficult to aspirate out the swollen lens fibers themselves. The second trick here would be in all intumescent cataracts, I realized that having a soft eye does really help in having a better control of the rhexis tear. So I would give massage to the eye by blocking it, either a posterior subtenance with a cannula or with a perivalvular block, and that makes the rhexis very predictable in these swollen capsules. So that was it. Thank you for watching and hope you found this helpful.